I was in the hospital and I couldn't walk. I had cancer at the time. I was really in bad shape. It took 2 years to get me going and get on the road.
For high-risk seniors without personal support resources, growing older can present many challenges. Dressing, bathing, preparing meals, assistance in the bathroom, and remembering to take medications all can be insurmountable obstacles to daily living. And yet the ability to stay in one's own home safely for as long as possible is the goal healthcare needs to achieve.
Many seniors in our community need access to quality community and home supports before and after their discharge from hospitals. The Mississauga Halton LHIN created and championed the 24/7 Support for Daily Living program with its providers to generate the right community capacity to support high-need and at-risk seniors in the community.
If I had to leave here, I would be very unhappy.
I'd have to go in a nursing home, and I don't want to.
Supports for Daily Living is a unique program developed by the Mississauga Halton LHIN and its supportive housing partners, working in conjunction with the hospitals and the CCAC. The program provides assisted living in the community for high-risk seniors with complex needs, most of whom are living alone and are over 75. These individuals are able to continue living in their homes as a result of access to frequent, urgent, and intense personal supports over a 24-hour period. Without this service, frail and high-needs seniors would end up in emergency rooms and in long-term care homes. Supports for Daily Living provides 24-hour availability, 365 days of the year, scheduled visits and on-call response, day, evening, and night, frequent daily visits by trained personal support workers based on the individual needs of the client, daily personal care and essential homemaking to assist with the activities of daily living, and safety checks, reminders, and urgent response.
The relationship between SDL providers and the hospital is a very important one. We have established a very interactive meeting where we discuss all patients that are getting ready for discharge that require more complex planning and thinking. So when we interact with them and think that supports for daily living is a viable option for a patient, we will invite them to come in and speak to the patient and the family, if the family is involved in that, and talk about the can-do pieces of it. And they are a big part in helping patients to understand the art of the possible and how they will be there for them and what can be done.
We're seeing ever increasingly complex patients whose care needs are quite high, who want to be at home in the community. Supports for Daily Living is one of those tools that we have to offer families to augment other services potentially so that they can actually stay in their home and be as independent as possible for as long as possible.
The results to date are impressive. Between 2009 and March 31, 2011, the Supports for Daily Living program enabled us to discharge 741 clients from hospital, divert 443 clients from long-term care, return 21 long-term care clients to the community, and eliminate 2,080 unnecessary emergency room visits. But perhaps most importantly, seniors who need it most are getting the care that enables them to stay in their own home.
We are improving the lives of seniors in our community and creating a high-quality, sustainable system by addressing the 4 R's: right care, right place, right time at right cost, and avoiding unnecessary use of institutional settings, both hospitals and long-term care homes. And it is a win-win for the healthcare sector, but more importantly for the seniors. And it is really for them that we created this program in the first place.
We all know that there's no place like home. So I think that that really speaks to how important supports for daily living are in that process. Not just the dollars, but the emotional and psychological gains for patients to stay home.
The benefits to family caregivers are also substantial. While reducing the overall amount of care that they personally need to provide, caregivers have increased peace of mind knowing that loved ones are frequently seen, emergencies are dealt with, and service is safe, competent, consistent, and reliable, provided by trained personal support workers.
When the patients are looked after in this kind of a program, it gives us not only peace of mind, but we're not tied up with having to deal with all these issues all the time. We know that there's another pair of eyes and ears that are looking after the patient, and they will be able to make assessments as to when we are needed, but we don't have to be on top of things all the time. We know that they're well taken care of, and there'll be someone that will alert us if there's a problem. It's a win-win-win situation for almost everyone.
What impresses me most about the Supports for Daily Living program is the can-do and the responsiveness.
They are very responsive, they're very collaborative. We are always impressed by how often and how willing they are to think outside of the box. And really, I think that's the future of sustainability of Medicare in our province and in our country.
The impact on health system savings has been dramatic. To March of 2011, total hospital days saved was 2,504 at a cost of $1,181 per day, and a total health system savings of $2.95 million. The 2,080 emergency room visits that were avoided, at a cost of $206 per visit, resulted in a savings of $428,000. Even if only half of all current 800 Supports for Daily Living clients had been diverted from long-term care, the savings amount to over $7 million.
The Supports for Daily Living program is a very important initiative in a community such as ours here in Halton region that is growing very rapidly and has a large population of seniors. So certainly any program that enables those seniors to remain in their residence reduces the requirement for paramedic services and correspondingly reduces the requirement to travel to hospital, benefits the system in general as there's a reduced requirement for utilization of the already busy emergency rooms. And the Supports for Daily Living program is obviously achieving those goals.
Evaluation of the results indicates a high degree of client satisfaction. As Dr. David Sheridan, lead third-party evaluator of the SDL program, notes, the program is positively viewed by system stakeholders, and there is a high level of coordination and collaboration. Converging evidence clearly indicates that the program is achieving the intended outcomes.
I wouldn't want to be totally alone because I'm not able to do all these things or wash myself. How am I going to do that? I need that help.
Supports for Daily Living is innovative thinking that is producing impressive, sustainable results in dollars saved, in stretching resources, and in providing the kind of care that our seniors want and deserve.
It's just made my life a lot more comfortable, that's for sure.
Everything is just works very well. I would recommend it to anyone.
My father really started to improve. It was a godsend to have this kind of a program available to us and to my dad.